Hello, everybody. My name is Jona Banach. I'm director at Interim from the Green European Foundation. And on behalf of the Green European Foundation and the Heinrich-Böll-Stiftung EU office, I would like to warmly welcome you to the first edition of our joint event series called Worldwide Pandemic European Responses. Before we dive into today's event, I'd like to shortly talk to you about why we are launching this series. It's needless to say that the ongoing COVID-19 pandemic is having a grip on societies worldwide and, of course, on European societies alike. In particular, we believe that this crisis has exposed some of the vulnerabilities of the European Union and its institutions. And European solidarity is called upon once again, and question marks are being raised. Even when the immediate crisis will be overcome, we believe there will be long-standing effects of the COVID-19 pandemic, including economical and social complications that we will have to deal with. The European project and its inherent values is therefore under immense pressure. And it's in this context that the Green European Foundation and Heinrich-Böll-Stiftung EU office are inviting you to analyze what is currently at stake, what can be possible solution for the future, and to have a participatory online talk already today so that we can together have a look at how the pandemic is influencing our daily lives as well as our political, environmental, economic, and societal models. With this in mind, we are going to cover over the upcoming few months topics such as public health, economic and monetary policies, mobility, and much more. It is in this context that I want to welcome you then to today's event, which has the title of Public Health and Societal Resilience, Which Role for the European Union? And I'm happy to hand over and to welcome our moderator for today, which is Mr. Sarantis Michalopoulos.
Thank you, Joanna. So I'm Sarantis Michalopoulos. I'm a network editor for Euractiv.com in Brussels. It's common knowledge that the COVID-19 pandemic found EU member states completely unprepared at different levels and exposed a number of shortcomings when it comes to coordinating a public health crisis in Europe. It is said that the European Commission had informed quite early EU member states to brace for a pandemic, but when the virus reached Europe, the initial reactions were kind of insufficient. The vast majority of EU member states started shutting borders unilaterally, while the lack of proper personal protective equipment put EU citizens' lives at risk. Many want to forget the fact that Italy, for instance, which was the epicenter of the pandemic in the beginning, asked other EU member states for masks and got no response. These kind of incidents have left open wounds and severely damaged the EU unification prospect in general. The idea of the European Commission having a greater role when it comes to public health issues and crisis management is increasingly gaining ground. However, such a decision still lies in the hands of EU member states and demands bold leadership to take such a step, especially at the national level. In our meeting today, we will try to explain the reasons why we had this poor reaction in the beginning, the lessons learned from this pandemic, and what is next at the EU policy level, especially in light of a potential second wave of the pandemic. We have the pleasure to have here with us two distinguished speakers, Ms. Ingrid Keller from the European Commission's DG Health and Safety Unit, as well as Mr. Petra de Sutter, member of the European Parliament for the Greens CFA Group. Each speaker will have 10 minutes to do a short introduction, and then we will open up the discussion with our audience. So let me start with you, Ms. Keller. What's the Commission's initial evaluation regarding this pandemic?
Hello, good afternoon, and welcome to everybody. Maybe before I start with the evaluation, I can take a step back and look at the framework in which we were actually confronted with the pandemic, because I don't think we came completely unprepared. As you may be aware, there is a decision on the health security framework of the European Union from 2013. It has a number 1082, so we usually refer to it as the Decision 82. And it puts in place some key activities and that were obviously helping us to manage this pandemic. So for once, there is the early warning and response system, which is an IT tool which very quickly and 24 hours a day, over 7 days a week, the Commission and the member states and also non-EU countries such as Switzerland and Norway, for example, are exchanging information on outbreaks. So as you can imagine, this was a very important tool for the member states to quickly communicate the cases and other information to each other. Secondly, thanks to this decision, we have the Health Security Committee. This is a committee where member states are represented by a nominated representative, could be from the Ministry of Health in most cases or from a relevant public health agency. And that committee has met basically every week in the crisis to coordinate, to discuss new issues, and also to take decisions on important issues to be taken forward for the Commission or maybe for the European Centre for Disease Control to work on it. Besides this committee, the committee has a sub-network on communicators that are exchanging information on risk communication, how this is handled in general, but also in the particular case of COVID at the national level. And then this more legal framework is also complemented by larger projects, what we call a joint action. So meaning member state institutes working together on a particular issue. And we have there, for example, the Healthy Gateways joint action on guidance and training on points of entry measures. And that joint action proved now instrumental and extremely reactive to providing up-to-date guidance in a very, very short time frame in terms of what concerns transport and points of entry, be it in air or from the sea or at land, for screening passengers or any other measures to be taken. And we have a second project also which looks more at laboratory preparedness and on collaboration of the laboratory. So if you're interested, the summary reports of the Health Security Committee, they are public, they are online, and we have, I believe we have had 25 meetings so far. So it is really a very close coordination between us and the member states. Generally, I would like to highlight that the Commission has reacted to this health crisis, not only in the health area, but obviously also in the area of economy and border and mobility, research. There are also several initiatives on fighting disinformation. And you may be familiar already with the exit strategy that it was proposed. And there were also communications on transport and tourism, which are important now with the upcoming summer and the holiday season. I would also like to highlight here the role of the EU agencies, in particular the European Centre for Disease Prevention and Control, that produces daily economic updates, not only for the EU countries, but globally. So the colleagues are screening more than 1,500 data sources every day to come up with the best reliable figures that are available to keep us updated on how many cases there are. They also update about deaths on their website. We have now also projections. We have, let's say, longer term graphs showing the development over the past months. So it is really a very informative website. The ECDC putting together in terms of epidemiological data, but also in terms of guidance. The ECDC has put out guidance for laypersons. For example, there's a specific leaflet for pregnant women, for specific vulnerable groups. The ECDC has provided guidance for certain settings, for example, long-term care settings, for hospitals, but also overall guidance in terms of monitoring and surveillance, for example. Then obviously also the European Medicines Agency is playing a key role here in supporting the development and approval of vaccines and treatments for the novel coronavirus. And we have seen that now for a crisis, and that's maybe already one of the lessons learned, these approval processes, as strict as they have to be, as thorough as they have to be, they should not be bound by too much administrative tape, because we need the treatments and the vaccines as soon as possible. But then there are also other agencies, for example, the European Union Aviation Safety Agency, that has been providing guidance from the beginning and also is updating guidance on a regular basis in terms of air travel for passengers, guidance for passengers, but also obviously for the crew. So occupational safety is also important here. We are working together with our agency in Bilbao on occupational health and safety. I maybe also can highlight that lots has been done in terms of promoting research. You may have seen that the European Commission is providing with loans to innovative companies such as CureVac to launch the clinical testing of a vaccine, and also more than 140 research teams not only looking for new treatments and vaccines, but also looking at to improve epidemiology and point-of-care diagnostic tests, for example, are also being supported to bring us further and advance our support here in the crisis. What is also important that and what we like to highlight is that with the ongoing crisis, we have been seeing more and more European solidarity. So countries have been donating materials to each other. Countries have been accepting patients from each other. And that is also a lesson learned, this cross country health system, how that can be improved. And there is already a regulation on cross-border healthcare, and there is already specific guidance also out there on how this can be done in the crisis situations. So one of the latest documents that we have been publishing is also a strategy in terms of vaccines. Having a vaccine would be a real game changer if you allow the slogan, as the virus seemed to be pushed back. For the moment, however, it is not completely disappeared. Just today, the ECDC, the European Center for Disease Prevention and Control, published a new risk assessment on the resurgence of the reported cases of COVID-19, looking also at candidate and potential candidate countries. So we are not only looking at the EU 27, but also beyond, as the virus doesn't know any border. So having said this, also coming back to the vaccine strategy, it has two different pillars. So with one pillar, we really would like to look at sufficient production of vaccines in the EU, and in order to ensure the supplies for the member states. And then in the second pillar, we are also looking to adapt the EU's regulatory framework, because, as I said before, we are in an urgency and there should be some regulatory flexibility. And that also is something we are discussing for the moment with the European Medicines Agency. So maybe I stop here as an introduction, and then we have time for more questions later on.
Thank you, Ms. Keller. Let me go now to Mr. Suter. According to you, what are the lessons to be learned from the pandemic when it comes to health crisis management in the EU? What went wrong, at least in the beginning, Mr. Suter?
Yes, thank you for setting up this meeting and inviting me to this. Maybe I will just say a few words on my background. I'm a medical doctor. Maybe that's also why I'm here. I'm a green politician, as it was said, of course. I'm chairing the Committee for Internal Market and Consumer Protection, but I'm also a member of the Environment and Health Committee and then of Employment and Social Affairs. So all these issues are maybe important because the crisis has affected them, and that's why I will maybe touch upon several of these issues. Now, your question, of course, is very broad, and I thought maybe I should also maybe comment on, you know, the beginning of the crisis when we all underestimated what was happening, and where indeed a lot of people asked us, definitely as politicians even more, where is the EU? Why don't we hear or see the EU? And I think that Ms. Keller has rightfully explained the amazing amount of work that the EU, the European Commission, and the agencies have been doing from the beginning of the crisis. Now, the problem is, and that this is a typical EU, I would say, architectural problem, that it's not always the member states that want to listen to the coordinated approach that the EU, that the Commission is proposing. And what we see is that in the beginning, all the borders were closed, just like citizens were buying toilet paper for themselves. Well, member states did the same for protective equipment and for masks and other COVID-related products. So it took a long time and a lot of efforts by the Commission to really convince member states that it was also in their best interest to open the borders, to allow the free flow of these goods, also healthcare workers and so on. And we have seen some nice examples of solidarity, like, for instance, patients from one member state that were transported and admitted to hospitals in other member states. I think Germany can be named here for having done a lot of work. Now, the question that you have put is, what are the lessons learned? Well, as you know, politician, again, I would say we need to strengthen the competencies of the EU to act in times of crisis management, in public health crisis like the one that we have seen now, because we don't know what's going to happen in the future. And I think many people have understood that health and public health are so important, and that member states on their own are not able to face such a crisis. Of course, also in the other domains, the economic domain, the social consequences, and so on. But definitely in managing the public health aspects, which we're discussing today, much more collaboration at the European level, at the EU level, is definitely the way to go. And we'll have to see how to do that to enforce the agencies. And it's, of course, going to be a matter of budget and personnel, but we really have to do that. That's my personal strong opinion. Now, maybe opening it up a little bit, the subject, because if we talk about public health, we can of course go further and say that actually the EU should have more competencies in health issues, you know, in general terms. I mean, the fact that we take a lot of policy decisions that affect our health is an important fact, and what we would like to see is that there is a real health in all policies approach, as it is called. There is health consequences from our trade policy, employment policy, food, agricultural policy. They're all connected, so we cannot distinguish these from each other. And in many of these areas, I think prevention is key, and it should really not only be to the benefit of the citizens, of people, but also of national health budgets if we invest in prevention. I think that's a very obvious thing. And there we can look at all kinds of matters. For my personal, I would say, political agenda, I'm very much interested in chemicals and in endocrine disrupting chemicals, for instance. But we have carcinogenics to regulate. We have to work around air pollution. We can talk about tobacco consumption, alcohol abuse, promotion of healthy diets and so on. And I know, because of the cancer program of the Commission, of course, has been announced already before this crisis, that these are also priorities of the current Commission as a whole. What we also need is to strengthen the health systems and the health forces in our member states, because the problem of the virus has the crisis now with the coronavirus has shown that the health systems themselves need strengthening. And it was very clear from this crisis, I think, that it is mainly the public sector that has been instrumental in helping to solve the crisis, and we need to be aware of that. So if we have lessons to learn from this crisis, that is that maybe, and that this is something that has to be done at the level of member states, of course, as well, that we really have to invest again in healthcare and strengthen the public sector as a whole, because that's the one that will lead to resilience if there really is a crisis, if we really want to be prepared for another outbreak or second waves and so on. We will have to work on that, because these healthcare providers, for instance, are the ones that we have been applauding every evening at 8 o'clock in many countries. But we have been cutting the budgets in the healthcare sector for many, many years previous to that. And many member states were not prepared in having strategic stocks, for instance, for masks or other equipment and so on. So these are investments that have to strengthen our resilience capacity, whereas in the healthcare sector and in the public sector as a whole, we have seen an evolution towards more efficiency, more cost efficiency, and this is understandable, but leading to the absence of any buffer capacity for crisis. And in that case, it's always the public sector and governments that have to solve this. So we have to rethink some of the models that we have in place in healthcare. I would like to touch upon, if I may, the whole issue of medicines. And Ms. Keller also mentioned the strategy on the vaccine. We're following up very closely what's happening there, because we see different things happening. We're very happy with the initiative by the European Commission that came very shortly after, as you will know, 4 member states, Netherlands, Italy, Germany and French, had an initiative which they called the Inclusive Vaccine Alliance with AstraZeneca to have 300 million doses of the vaccine if it would be developed by AstraZeneca for their own citizens. This is not the way to go. And now the Commission has done a better job looking at different vaccines in development, talking to different providers and promising that it would be available for all member states. And hopefully, if you ask me, beyond, because of course we have a global crisis and we need to protect all other people around the globe, because the virus doesn't know frontiers, it travels all the time. So we really have to take care of everyone. And I would very much be disappointed if I would see a kind of a Europe first strategy like it is done in the US. You know that they have bought the whole stock of remdesivir. Just recently it was announced. This is not the way to go. We really have to do it differently. And if it's possible, review maybe also the way that the development of medicines is done today, because you can discuss the price setting of this vaccine. It should be affordable, it should be available, it will be funded with a lot of public money. So the least that we can ask, of course, is transparency in that in that whole process, and putting indeed the vaccine affordable and available for all. I have heard rumors of negotiations where companies are developing vaccines and proposing a value-based price for the vaccine, which means what are you willing to pay, to prevent a new lockdown? This will be the price of the vaccine. I think it would be totally immoral to accept that. And we know it's current practice in many other diseases, think of orphan diseases and so on. So this is something we have to watch carefully. And then finally, maybe I would like to touch upon the idea of health sovereignty, because what we have learned as well is if the borders are closed, and we are in need of paracetamol, that all our paracetamol comes from India. We know that the active medical ingredients for our own pharmaceuticals, for 80% come from third countries. That was 20% 30 years ago. So we went from 20% to 80% dependency, of course, of third countries. We have to think about these strategic and essential domains like medicines, and of course there are many others, but if we talk about health, let's talk about medicines, whether or not we need to relocalize, reshore some of the production of these essential things to the EU in the future, and how that will affect markets and trade and so on. It's a huge exercise, but it has been by the Commission itself already put on the table. We have Commissioner Breton in IMCO, of course. This is not a taboo anymore. This is very interesting. And this will be also lessons learned from this crisis for the future. And then maybe just to end, this is not just a health crisis. We have to know and understand where this pandemic, which is a zoonotic disease, of course, comes from. And then we have a lot to say about how we treat our ecosystems and the biodiversity, and how fast this virus has been able to travel because of the globalization of the current societies. So this also should be part of building the resilience towards next crisis.
Your messages, Mr. Suter, were quite clear, but I want to focus on something. You mentioned before the need to invest in public healthcare systems. I'm afraid that after September, if we don't have a second wave, or even after the second wave even, we will forget this discussion. How do we make sure that these priorities from now on will keep alive in order to take concrete measures toward this direction?
Wow, that's a difficult question. I think it's our job as politicians to keep this on the agenda. I will maybe touch upon something else. If you ask people in the street what was their experience during the lockdown and the COVID crisis, what has been shown to be the most important to them, they will say our health. They will say the contact with family and friends, which was impossible because we couldn't see them, because we were in bubbles, and there were a lot of restrictions of that. And also the fact that we didn't have, a forest or a park just to have some nature and some fresh air to get out of our apartment where we were locked. So I think that maybe not all people, and I understand a lot will say back to business as usual, the fastest the better. But a lot of people will remember what this crisis has really brought as an insight to what is really important to them. And we as politicians, we should bring that to the agenda. And if we have budgetary discussions on priorities, where to invest, then we will have to take these things with us. And for instance, but that again, maybe mostly at member state level, of course, is to rethink how we will finance our healthcare systems and how we will reorganize maybe the healthcare and the care. Remember what happened in the nursing homes for the elderly people. It was terrible in many member states, in many countries. What happened to these people? Where did we go wrong that we ended up in such a situation that they were really abandoned, and most of the casualties fell there. And of course, I'm speaking from my own country, but I know this has been the case in other countries. I think people will remember that, and they will say, yes, indeed, we have to change something, and not let that happen again ever. Of course, at the European level, we and I'm a green politician, and allow me to bring this here today, of course, are very much convinced that if we have to talk about recovery, and this will be an economic recovery program, of course, mainly, and we'll have to take care of the social aspects for sure, but that this should really be guided by the Green Deal ambitions that the Commission already had put on the table from the beginning of this term, and that has, and I want to repeat it, and I repeat it all the time because I'm living in Flanders, where this is not always obvious, but it has a large political majority across political groups and in most of the member states. and it is very much at the core of the recovery plans that the Commission is defending. And this is really the momentum of doing it differently. And we always use the very nice comparison. I think if your house burns down and you have to rebuild it, you will not rebuild it with the materials and the methods of 30 years ago. You will rebuild it with, you know, the eye to the future in a sustainable way, and with renewable and new materials and so on. You will look at where the aims that we have to attain 2030, 2050, and I'm talking about climate change, of course, that is the way that we have to do that. And these are lessons to be learned from the crisis. And as politicians, we have to keep repeating it and also telling it to our voters why this is so important.
Thank you, Ms. De Sutter. Now, Ms. Keller, we understand that EU citizens want more Europe when it comes to healthcare, public healthcare. Is the European Commission planning any kind of specific initiative? Because the European Commission chief Ursula von der Leyen has spoken about a white deal for healthcare.
Yes, as you may be aware, we are in the middle of a lessons learned exercise, and there are several things already crystallizing. Maybe first of all, also to show how serious the European Commission is taking the importance of health is the EU for Health program that has been published a few weeks ago, the proposal, and we are now starting to enter the further discussions on that. And with the EU for Health program, you know, there are now 9.4 billion being proposed as a budget for health, exclusively for health in Europe. That's actually 23 times more than before. So, and also along with this proposal, you said, if there's no second wave, will we forget about health? I don't think so, because we have, for example, this big proposal on the table, which shows the importance. So I don't think that will make us immediately forget, even though hopefully we could avoid a second wave altogether. So this EU for Health program would be looking at tackling cross-border health threats, and it would also look at making medicines available and affordable, and also strengthening health system. And Madame De Sutter alluded to this. This is really an important point, that we have also seen that our health systems need to be strengthened in terms of accessibility, efficiency, and also resilience, reducing inequalities. And there, for example, also best practice in changes can be very helpful. So this is certainly one point where we are very concretely also working on. And then maybe a second concrete point is also the fact, and Commissioner Kyriakides announced this last Monday in the ENVI committee in the Parliament, that we are preparing a Commission communication on the preparedness for a possible research. So instead of waiting and see what is happening, and part of it, it's also, as I said, the constant monitoring by the ECDC and the new risk assessment that came out today. But we, in this forthcoming communication, we are looking at early detection and response. So to be much more also on the guard and watching to see that if there's a second wave, how can we together, you know, early react and avoid any of those scenes we have unfortunately had to witness in March and April.
Yes, but do you believe that at the political level there will be a specific initiative, for instance, when it comes to crisis management? Because many people, many analysts talked about the need for an enhanced role of the ECDC in particular. Do you see such a political move, your personal estimation, coming up in the next months?
Well, as I said, we are in the middle of a process of looking at the lessons learned, and we are obviously doing this together also with the agencies and also together with the member states. So there's the German presidency now starting, And I'm sure there will be discussions in the upcoming EPSO Council on this. But for the moment, it is too early to make any judgments to say in which direction we will be going.
And when it comes, I want to get back to the initial question. When it comes to the crisis management of this pandemic at the very beginning, there were some shortcomings. Before I mentioned shortcomings, but I was actually referring to the EU member state level, not the European Commission. I even stated that the European Commission informed EU member states, according to my information, since January. But the member states' reaction has been late. So my question is, what went wrong back then in the beginning? Why the EU member states, according to you, this is a question for both of you, didn't manage to be on the same page, at least in the first 3 weeks?
Maybe if I will give a political answer, of course. I think member states first did not as many or did underestimate, of course, the level of this crisis. Health is a member state competency, so they were judging that in the interest of the public health of their population, they took the right measures, which, of course, in the end was a cacophony of measures and of closing borders and taking all kinds of measures, even keeping material for themselves and so on, as we discussed. It is a psychological basic reflex, just like people went to the supermarket and bought spaghetti and toilet paper just to be on the safe side if something happened. Member states did exactly the same thing at their level. It is because of course, the competencies are what they are. And I also have information that the Commission really tried to bring the ministers of health together and have a coordinated approach in the beginning. And, there was not much of a response because of that reason. It's only afterwards, when they understood how important it was, and it was not just China, it came to Europe and it started spreading, that they understood that they needed to collaborate and that they started, following recommendations and guidelines from the European Commission side and the agencies. Of course, if we could strengthen that and give more powers to the European level in the next crisis, it could go faster and they could listen and obey, I would say, what Europe, but it's dangerous to speak in these terms, what the European Commission proposes. And there will be ongoing I guess, discussions now to indeed be better prepared in the next crisis. It's not always ill will, it's very complex why member states have reacted as they did. 3 member states in the beginning, and at the end only Sweden believed in the herd immunity theory, so they took all different measures, and of course the UK and Netherlands very quickly changed their minds. I guess we need to be on the same plate in the next crisis also on that issue. And there is a lot of things that we still need to discuss, how to work with the tracing apps and how to prepare for a second wave if there is one and so on. I'm hopeful and really expecting that it will be better next time. I wouldn't be too harsh looking back, because of all the reasons. It's easy to find guilty, who is guilty and who did what, mistake. But let's learn from them and let's make sure we don't make these mistakes a second time. That definitely would be my hope.
Ms. Keller, would you like to say something on that? Or
yes, maybe just to complement with one example here. We have also under this decision 1082, the option for joint procurement, meaning that the Commission makes a contract with one or several companies to procure certain items. In this case, now for COVID, it was masks, but also ventilators, gloves, and other personal protection items. This option and the joint procurement agreement exists already more than 5 years. And until now, not all member states had registered and had signed it. So, but with the crisis, suddenly the interest in this joint procurement agreement was very, very high, and member states pushed it also through their national parliaments to agree that they can participate. So since I think it was in the middle of April, instead of 24 or so signatures, which we had before, we went actually up to 36. Because we also allowed Western Balkan, the candidate and potential candidate countries to participate. So for me, this is a very clear sign that member states, maybe coming without a package of heavy crisis experience, thought, oh, maybe joint procurement could work, maybe not. Let's watch, let's see, let's discuss a little bit further. But when they entered the crisis, they found this instrument very, very interesting. And we have now 5 calls, and most of the member states are participating, and also the non-member states, obviously. So I think this is a very nice example of the solidarity and the working together and the positive and the EU added value in this that came maybe a bit late, but that was certainly seen by the member states.
Thank you, Ms. Keller. Mr. Schuder, you have a panoramic view about the current state of play when it comes to the EU single market. Can the EU single market afford a second lockdown in the event of a second wave of the pandemic?
Yeah, it's a very good question, because the single market has, of course, suffered from the crisis, exactly as we said, because borders were closed, and then the green lanes were installed, the lanes that were, allowing priority passage of people and goods that were essential for the management of the crisis. It has suffered, but on the other hand, it's clear that the single market is also the solution out of the crisis, because if we talk about protective equipment, again, one country, one member state could have enough masks but no ventilators, and your neighbor could have ventilators and no masks. So you're stronger together than to share these equipments rather than to close your borders and keep everything for yourself. So the single market definitely is also extremely important in building this resilience towards crisis, whatever crisis that could come to in the future again. On the really economic side of things, it's much more complicated, of course, because when we look at supply chains, we've also seen here that we are so dependent on suppliers from outside of the EU, third countries, and as I said already, for medicines, there is other essential areas, of course, where we have really to think whether or not we have to stockpile or reshore production. I know the Commission also has been thinking about that. Definitely for masks and ventilators, there will be no discussion here, I guess. But you could also think about food and about other things that are really essential in case we would even get into larger crisis. So the single market will protect us and make us more resilient because of the size, because 27 member states, of course, have much more resilience to offer than each member states separately. On the other hand, closing borders of the EU towards the rest of the world is also not the way to go. If you talk to people that are really experts in economy, of course, nobody is asking to get back to a closed economy and protectionism. That definitely is probably not the way to go. But we will have to find the right balance between being just as protectionist as needed to be resilient for next shocks and next crisis, and on the other hand, of course, keep our economy open enough to keep the welfare that it brings to have trade and the market in the first place. But that is just the economic view of things, of course, because there is so much other things to say that we need to address with this crisis as well. I told you that I'm a member of the EMPL committee. We've been working on cross-border migrants, for instance, in this crisis as well. And we have seen in the news, of course, the images of people from Eastern European countries in slaughterhouses in Germany, in the Netherlands, that were massively infected by the virus because there was no protection. And it was very, very clearly seen in what poor circumstances these people have been brought there and have been forced to do their work. So there is a very strong social dimension as well that needs to be taken care of in our single market environment, and we're absolutely not there yet. If we talk about social rights, of course, it's quite another subject.
Do you believe that you mentioned before the European Green Deal and the green initiatives at the EU level, which is also part of the Recovery Fund discussion that is actually taking place now? We have a crucial EU summit next on the 17th of July. My question is, you basically refer to a holistic approach when it comes to public health, including climate. How can we, on a legislation level, how can we bring the European Green Deal, for instance, closer to public health? And that's the policy focused on the policy level. And on a public opinion level, how can we convince EU citizens that climate, for instance, is tightly connected with public health?
I guess you addressed the question to me again. I think
it's for both. It's for both.
Okay.
Yeah.
Okay. You want me to start, or Ms. Keller?
Please, go ahead.
Okay. You know, it's not a difficult question. You talked about climate change. I will start with what the WHO has said. Dr. Tedros, who's the director of WHO, he clearly announced, and this is a very green view on things, of course, that this pandemic is a result of our relationship with ecosystems, with the planet, if you wish, with shrinking habitat for animals, with biodiversity issues, and that it is the critical interface between people and pathogens that leads to zoonotic diseases, which is, for instance, viruses that move from animals to humans. And this very important relationship that we are losing, that we are damaging, is absolutely at the core of what I already mentioned, which is the One Health principle. And the One Health principle means that we have to look at health everywhere, both in people, animal, the planet, the environment. That's one way to look at it, and that means that we have to talk about food and agriculture and deforestation and everything. On the other hand, climate change in itself has a direct health implication because it increases the risk for vector diseases, for infectious diseases, bringing in pathogens because of the rise of temperature. It changes our ecosystems and the habitats of pathogens tremendously. And it, of course, with all the weather phenomena that we know, it also directly affects the health of people. And there is a relationship with air pollution, for instance, as well. So all these things are connected, and that means that in our policies, we have to take them into account. I'm an absolute believer in taking health in all the policy decisions that we make, and see what are the effects on public health, just like I am for gender mainstreaming or social aspects of the measures that we take and the policy decisions that we make. So the connection between public health and between the environment, actually this is what brought me into politics, the endocrine disrupting chemicals and health as a doctor, but this connection is crucial. It's of course a difficult one to explain to people because it often is long-term. Environment and health connections are long-term interactions. Think about cancer, for instance. And climate change is also abstract, long-term. It's difficult to explain to people, except that some of the phenomena that we see today in the weather conditions, you are blind if you don't see them. Although even there, people say that it has nothing to do with climate change, but they affect also the long term. That means we're talking about targets for 2030, 2050, that's over 30 years. That means we're talking about the next generation. And that's difficult for politicians because, you want to be re-elected, and this is in 5 years, not in 30 years. So it asks
this is something that the politicians should reconsider, to be honest with you, after this pandemic. But let me go to Ms. Keller. Is there a feeling, this kind of feeling in the European Commission, that the approach from now on should be a holistic one? I mean, there is no solely climate discussion. It's also linked to public health. Do you believe that we will get rid of this fragmented approach at the policy level from now on? Could you please unmute? Yeah.
Sorry, I think I can give you two examples here. The Commission recently started the public consultation for its pharmaceutical, or for the forthcoming pharmaceutical strategy. And for example, it is highlighted clearly there that one of the issues is the impact of medicines on environment. So maybe if you would look at previous approaches, that was not so clearly spelled out. So I think that's a clear indication. And also there has been already the proposal for the farm to fork strategy. So in previous years, maybe also just the title was already different. So having the fork in here in the title, meaning it goes to the citizens, it goes to their mouths, meaning it's for their health. And the subtitle to the strategy also mentioned that we need a healthy and an environmentally friendly food system. So just by looking at those two policy initiatives, you'll see that the more holistic approach is certainly there. And that, I think, was what you were asking about.
Thank you, Ms. Keller. We have a question from a participant who basically asks if member states should collaborate also closer in the training of medical staff. Because apparently during the pandemic, there was a kind of mismanagement when it comes to medical staff. This is a question for Ms. De Sutter.
Yes, if you ask me, I would immediately say yes. In one of the proposals that from our political group we have put forward, we were thinking, and that's a part of the crisis management approach, of course, to put together some kind of a European health force that are doctors, nurses working in hospitals all over Europe, but that could be mobilized very fast if there is a crisis, to go there where they need to be, just like we have for fire outbreaks. You could do that also for public health and for pandemics. And it is clear that doctors and people, that health professionals that have to manage this kind of crisis, need the same approach, the same education, so that they're prepared. And if there is failures there, we have to work on the level of education and collaboration to make sure that this doesn't happen with the next outbreak. I should know the details exactly of what the person that asks the question is referring to be more specific, but in general terms, I think this is extremely important, and not only for crisis management, but just in general. If we allow doctors to move across Europe and to be able to practice medicine wherever they are in any member state, it's clear that there should be a common basis in their training, in their education, and a common standard and quality standards. So yes, clearly.
Let me ask you another question, because there are 7 minutes left. This is for both of you, but I don't know to what extent the European Commission can reply to that. But how do we bring back suppliers to Europe? Because it's the member states actually the ones that push them out. How do they bring them back?
Yeah, that's a difficult question. It will be on the agenda how to find the balance I was referring to previously, and I have had quite some debates on that issue. If you are talking about reshoring and bringing the production of certain goods back to Europe, there will be consequences. In one of the debates, I received the question that in that case, we might harm labor forces in third countries who are dependent on that production. Yes, and on the other hand, prices will go up if we reshore production back to Europe because of reasons that we know why in the first place the production has left Europe in the past. So how to do that? It will be a very delicate balance where there will be a lot of factors playing roles, and how then indeed we need to create legislative environments and frameworks to do that in a good way, without falling into protectionism again, and giving incentives to industries to do this. It will also depend on, of course, the geopolitical and global market situation outside of the EU. It will not only depend on us, it will depend on what the US is going to do, what China is going to do, and how we relate to these countries. So it's an extremely difficult question to answer.
Mm-hmm. And one last question for both of you. Your estimations about the upcoming discussion over the EU Recovery Fund. What do you expect from that? And if we ultimately going to have at least an in principle agreement in July, or it's going to take more time, as many suggest?
Maybe Ms. Keller can go first.
Well, there are certain questions where my crystal ball is failing me, I have to admit. So, I wouldn't want to prognose too much here. There is certainly a goodwill and lots of energies also from the side of the member states that are visible and communicated towards us. And I think everybody is positive. Now, about the exact timing, as I said, my crystal ball is not with me on that issue today.
Yeah, I will just join you. I'm not too pessimistic. Of course, we see a lot if we read the newspapers, but we are already making steps forward. Of course, the so-called frugal four will still ask for guarantees and have their demands. Maybe the global budget that was proposed by the Commission will not be what they have proposed. It should not go down too much if you ask Parliament, of course. And maybe the conditionality and also the proportion of subsidies versus loans, it might not fully be what the Commission proposes, and there will be some political debate on that. But I really hope that we will have an agreement, maybe not in July, but at least before the end of the year, clearly. And I expect actually quite a lot of the German presidency, of course, in that regard. I think that the German presidency and Mrs. Merkel, who of course will have more influence in the process now, might have a beneficial effect on the negotiations. So I'm not too pessimistic.
Mm-hmm. But you mentioned the word conditionality, which can open the Pandora's box in this in this case.
Yes, okay.
Please,
I will use it in the way that I've heard it from the Commission as well, and I mean with that all the recovery plans should really.
No, you were correct. You were correct. It's conditionality. Yeah, I mean, if you have to make reforms, it's a condition, to get the funds. My question is, if we're talking about strict conditionality, how can we make sure that we will avoid a two-speed scenario when it comes to the European unification process from now on?
Yes, I was just trying to explain that for me, conditionality is not meaning macroeconomic reforms as we've had in the financial crisis 10 years ago, because that is not what we want to go to. Conditionality for me is, aligned with the Green Deal ambition of the Commission, aligned with, of course, the digital agenda. I mean, we are not going backwards. We're not going to subsidize fossil fuels and old technologies. It's like the analogy with the burning house that I make. That's for me the conditionality. I mean, it's not pushing for austerity, and it's not pushing for macroeconomic reforms that will damage social policies and ecological policies in member states. This is exactly what happened 10 years ago. We've seen what it did to Greece, for instance. No, this is not the conditionality that I meant. It is the Green Deal and the digital agenda.
Ms. Keller, would you like to have 1 minute for your final remarks, and Ms. De Sutter as well, if you wish?
Thank you. Yes, well, I would like to thank the Heinrich-Böll-Stiftung and the Green Foundation to give the opportunity and to organize this series of talks. I think it's important to be transparent, to discuss, and also use the opportunity of the new means that we have been learning to use now during the pandemic, of having online chats, which give the possibility to many, many more citizens actually to be active. So I think not everything is negative when we are physically distanced, because we can be socially close. And this is also, I think, a very important point from us, that we are not speaking about wanting to socially distance people, but we just need to be making sure that we are physically distanced or wearing our masks also when we go on vacation, because the virus will not be on vacation. So I think it is also the responsibility of each and every one of us to help to avoid a second pandemic. Because there are certain measures, and I guess everybody is very well familiar with the recommendations in terms of cough etiquette and hand hygiene, that will contribute to other measures the local or national authorities can take in terms of avoiding a massive spread of cases. Whereas we are, and that's what our experts are telling us, that we will continue to be hearing about cluster outbreaks in the next month. And as I said before, we have the vaccine strategy, and we are trying to be ahead as much as possible of certain developments, so that we can make sure that vaccines will be available to priority groups first. It is not a big secret that such a vaccine will not be available in 6 billion doses ad hoc for the whole population of the world. So we have to go step by step. But the Commission is really doing what it can, and in very concrete discussions with the developers and the producers to make sure that once it is available, we don't also know when this would be, that it will be also looking after the health of the population in Europe and beyond.
Thank you, Ms. Keller. Mr. Sutter?
Yes, well, I will be shorter because a lot has been said. I think that what we should not do is say, and it's not to contradict what Ms. Keller just said, because I'm convinced we need a vaccine myself. But we can't say, well, we have a vaccine, problem solved, back to business as usual. That would be a big mistake. We have to learn the lessons from this crisis, starting from why we had this pandemic, how could it exist, and what to do to make sure that we don't have other issues like that in the future. And secondly, maybe rethink some of the models that we've been using in our economic policies, in our policies tout court in Europe at the European level, how to make the difference as, again, lessons learned from this crisis, looking at the holistic picture, as you also mentioned, looking at how everything is interdependent and dependent on each other. And so not only as just a health crisis that we will solve with the vaccine, there are social consequences, there are economic consequences, they have consequences for our relationship with ecosystems, and so on and so on. So we have to learn how to build resilient, better systems for the future from this crisis.
Thank you all for this quite constructive discussion. I think you both presented wonderful ideas and food for thought for all of us. Let's hope for the best, to be honest, for Europe, for EU citizens, and for the rest of the world. I wish you a nice afternoon. Let me thank the organizers as well. And let's hope for the best possible solution and outcome in July summit. Have a nice afternoon.
Okay, thank you.
Thank you. Bye-bye.